Hello, good evening, guys. Welcome to the live broadcasting of Erufu, the online community medical support network. I'm Shireen. As it's the largest organ in the body, the health aspect of skin should not be overlooked. In fact, there are certain kind of skin condition that may worsen with age. And while some of the conditions might be because of genetics, others may be due to hygiene, allergies, and environmental factors. Therefore, it is important to identify what skin condition you are, as well as the type of treatments and skincare products that is suitable for you. Today, we are glad to be able to invite a certified aesthetic physician, Dr. Diana, the healthcare partner of Erufu Care, to give us a sharing on the common dermatologic disorder, acne vulgaris, management of scalp, and cosmeceutical in skincare. Welcome, Dr. Diana. Hello, Dr. Diana.
Hi.
Okay.
All right.
Okay. Before Dr. start, I shall give a brief introduction of Dr. Diana. So Dr. Diana was graduated on 2008 at Malacca Manipal Medical College. She has undergone training in PPUM, completed services in Hospital Ampang. Dr. Diana worked in a wellness medical clinic and GP clinics for the last 10 years. She is a LCP certified medical practitioner and also the member of Academy of Family Physician in Malaysia. And she has started her private practice in Calico City. Dr. Diana's special interest is in microneedling, therapy, and treatments of acne patients. No more further delay, I shall pass the session to Dr. Diana.
All right. So thank you, Shireen. Hi, a very good evening to all. Thank you for joining me today. Before I start, I would like to thank Shireen and also the Erufu team for organizing this talk. And I hope you can join me while relaxing at home and have more insight on the topic that we're going to discuss today as mentioned by Shireen. Okay? So I'm sharing my PowerPoint now. Okay, so this is my topic today. So as we go to the first slide. Okay, so acne is the most common skin complaint and also skin concern among the young adult and some of the older patients. And it affects almost 90% of the young adults, and in one study done in the local university, it is among the third highest condition in comparison to another two commonest skin disease in Malaysia. Yeah. Okay. So what is acne? Acne is an inflammation disorder of the sebaceous gland. So as you can see in this diagram, this is the sebaceous gland that is connected to the hair follicles and our pores. Okay. Its function is to form a protective effect to the skin, which is to form a coating against skin friction, and keeping the skin moist and lubricated. So in short, if your sebaceous gland is inflamed, there is a big possibility that you are having acne. Okay, so which area you can get acne? Mostly on the face, back, and chest. Okay, so what are the type of acne that we know? Okay, acne can be divided to non-inflammatory and inflammatory type. So the non-inflammatory type is the blackhead and the whitehead. So the blackhead, which happen to be dark, as when the pores are open to the sebum and the sebum out and the waste product within the pores become oxidized after exposed to the environment. And the whitehead is the acne with accumulation of the sebum here that is within a closed pores. So when the skin is trying to protect itself from accumulation and spread of the bacteria by releasing some protective cell, which is the white cells, this is when you get inflammatory acne. Okay, this includes papules here, the red swelling without pus, pustule, which is the swelling with pus here, and also cyst or nodule, which involve the deeper skin, which is hard and painful in the case of a nodule, soft in the case of cystic. Okay, so the type of acne pimples. Okay, from these pictures, you can really see the stages of acne from the small blackhead to whitehead to the development of the pustules with marked spread of bacteria here, waste product, and also the dead skin and infected sebum. And so we often wonder how does acne progress, yeah? So the theory is when there is an accumulation of dead skin and also sebum um, that clog the pores. So this gives the opportunity for the bacteria to spread and proliferate. So hence this causes inflammation and formation of acne. This is just a repetition of what it seems to be the process of inflammation and pathogenesis of acne. So if you notice, when you look at the nodule acne, there is a marked inflammation and there is also risk of scarring. Right. So usually in the clinic, the acne is graded from mild, moderate to severe, and from grade 0 to 5 via certain scale. Okay, these help us in the clinic to manage patient with acne and plan for the patients to improve their acne. So the scale that we commonly use is the comprehensive acne severity scale, and as you see here, the grade, the mild and grade 2 is easily recognizable. Less than half of the affected area is involved and many comedones and papules and pustules. And then when you look at the moderate acne, which is the grade 3, more than half of the affected area, for example, if it's the face, then more than half of the face are involved with numerous comedones. Comedones is the blackhead and whiteheads, and papules, like I mentioned just now, and also pustules. So when you look at very severe acne, which is grade 5, there will be high inflammatory acne covering almost all over the entire affected area. And also there is an involvement of nodules and cystic acne. Okay, so how do we get acne? Okay, acne can be caused due to these four causes. Okay, number one is when there is an increase in sebum and oil production in the skin, and then when there is a spread of bacteria, which is the Propionibacterium acnes, and also when there is an altered skin cycle with accumulation of dead skin and also inflammations. Okay, so sebum production is known to be increased when there is an overstimulation of the sebaceous gland, and also possibly due to hormonal imbalance or overstimulation of the hormones. Okay, and the Propionibacterium acne also release certain chemicals and also chemotactic factors that can actually induce inflammations. So, and it is known that in acne patients, the rate of desquamation, which is the removal of the dead skin, is also the skin cycle is also affected and also altered. Okay. Right. So, who are at risk of getting acne? Okay, there is a number of factors that has been discussed, and however, the evidence is limited. And the most widely discussed is family history, genetics, smokers, and also stress. So, genetic and family history play an important role. However, the mechanism of how family history has relation with acne inflammation is not fully understood. So smoking, as we very much agree, can increase inflammatory process and also can increase the tissue and cell damage. So that is how it is affecting people with acne prone skin. And also stress level, as we know that this can cause hormonal imbalance and etc. So let's talk about diet and in relation with acne. Okay, so as as we know, okay, high sugary diet can affect your skin. Okay, so in a few studies that is done, okay, low glycemic or low sugary diet can significantly reduce the total acne lesion count as compared to people who take a high sugary diet in individual age 15 to 25 years old. So in another study that is done, there is a weak association between all type of milk with worsening of acne. And one study that is done, they find out that people who take high fiber diets has low occurrence of acne. And this is one thing that is good for everyone to know that there is no good evidence of oily food in the pathogenesis or formation of acne. Okay, so now that we know how acne is developed and what are the causes, let's go into detail on how to treat it. Okay, the main aims of acne management is to reduce clearance of the lesions, to maintain remission and relapse, to prevent complications. So treatment can be pharmacological and non-pharmacological, and pharmacological treatment can be divided into induction and maintenance. So induction treatment is the phase of treatment aims to induce acne reduction or remission, which can be achieved using topical, like topical creams and systemic agents like oral medication. Okay. So as you know, recurrence can happen in acne infections. So maintenance therapy is very important, and it is a very important modality as part of the comprehensive management of acne. So the mainstay of maintenance treatment for acne is most of the time topical treatment. Okay. What are the topical treatment that is available and can be offered to acne patients? The most common one is topical benzoyl peroxide. Okay, so topical benzoyl peroxide, okay, has an antibacterial, anti-inflammatory properties, meaning to say it can reduce the bacterial spread and also reduce the inflammation and the swelling. And the other one is topical retinoids. Retinoids is a derivative of vitamin A. Okay, it has the anticomedogenics and anti-inflammatory properties. Anticomedogenic means it can reduce the blackhead and whiteheads, and it is also suitable to be used for the non-inflammatory and inflammatory acne type. Okay. The next one is topical antibiotics. They are specific and certain and topical creams, antibiotic creams that is used to acne patients. And also another one is topical salicylic acid cream. Okay, salicylic acid is a cream that can actually control the sebum, and also it has the comedolytic effect, which also actually reduce the blackhead and also whitehead production. Okay, a thing with topical therapy is it should be applied a very thin layer to avoid side effects, and most of the time it should be avoided by pregnant women. So now let's go to the oral treatment. So you have a few options, which is the oral antibiotic, oral tretinoin, which is oral vitamin A, and also oral hormonal therapy. So some doctors would give hormonal therapy. This is usually involve combined oral contraceptive pills, which thought to reduce acne in a few ways. So the combined oral pill decrease the testosterone level and also prevent the conversion of testosterone to DHT. Okay, mild side effect of nausea and vomiting, but this is just temporary. And oral vitamin A are commonly used for the treatment of the, sorry, oral vitamin A is commonly used for the treatment of nodulocystic and also severe acne. It targets to reduce all the four causes of acne, which is control the oil, reduce the inflammation, improve the skin cycle, and also another thing is indirectly it also reduce the spread of the bacteria. So in my practice, most commonly I give oral antibiotic. Right. So you have oral treatment and you also have topical treatment, and some patients also still needs physical treatment or physical therapy. So the treatment that is available is comedone extraction, chemical peel, microdermabrasion, phototherapy, and lasers. So extraction has to be done in a sterile setting, and most of the time it's not preferable to be done at home. So the disadvantage of comedone extraction is blackhead extraction is it includes incomplete extraction, recurrence, and also tissue damage. And not all the time in the clinic we do extraction. Chemical peel is a treatment that whereby we put an acid, layers of acid on the face. This is supposed to help with controlling the sebum or oil production, and also help remove the dead skin from the our new skin. Okay, and microdermabrasion is a treatment of gentle exfoliation of the skin using machines, medical grade machines. And phototherapy is a treatment using a certain wavelength that help to reduce inflammation and kills the bacteria. And lastly is the lasers. Okay, so what are the complications of acne? And what will happen if you don't treat acne? Number one, sometimes when you are lucky, it can resolve spontaneously. But when it doesn't resolve, and it can cause scarring. And the main type of acne scars are atrophic and hypertrophic scars. Okay, the wound heals in 3 stages. Number one, we have initially when you have wound, you have inflammation, and then after that, our tissue start to form, which is this granulation tissue formation, and also there will be tissue reorganization and remodeling at the final stage. So in one study showed that the inflammation in patient with scar is longer than of a patient without scar. So this shows treating the inflammation at the very early stage is very important to prevent the severity and the complication of scar formation. So when there is inflammation due to certain injury or insult or acne, the healing process starts. And when granulation tissue is formed, this is when damaged tissue is repaired, and when capillaries is formed and growth factor are released with collagen reproduction, and new tissue is remodeled and reorganized. And inadequate response results in diminished deposition of collagen, and tissue causes formation of an atrophic scar, while if healing process is too much, this will in turn form an hypertrophic scars. So other form of scarring that is associated with complication with acne is keloid scar. Okay, atrophic scar, if you can see, there is 3 subtypes. Okay, I speak box scar and rolling. Okay, one of it is not in the picture. Okay, ice pick scar is basically a scar that is very narrow with sharp margin and can be extended deeper to the skin. Okay, and rolling scars are scars that is usually wider and around 4 to 5 millimeter, and underneath it there is a fibrous tissue, dense fibrous tissue that actually anchoring the scar and causing rolling appearance from the external skin. And boxcar scars are round to oval or square depression with sharp edges. They are clinically wider and surface. Um, they are wider on the surface in comparison to ice pick scar. And hypertrophic and keloidal scar are more common in darker skin and most predominantly on the trunk. But when you have acne, you can have the risk of getting these scars on the face. So hypertrophic scars and keloidal scars are associated with excess collagen deposition and decreased normal collagen activity. And hypertrophic scars are typically pink, raised, and firm with thick hyaline collagen bundles that remain within the borders of the original site of injury. Keloid form a reddish purple nodules that extend beyond the borders of the original wound. So basically when you have hypertrophic scars, when you have an injury here, the scars will be raised, slightly raised, but it remains around and within the site of injuries, and it can resolve over time. But keloid scar, okay, let's say if you have a small scar here, a very small injury here, over the period of time, the scar become hard and it spread, and also it goes beyond the site of the injury. And sometimes it can cause some tenderness as well. Okay. Okay. What is the management of atrophic scars? You have some options, which is chemical peel, microdermabrasion, laser resurfacing, skin needling, subcisions, skin grafting, and punch technique. Skin grafting and punch technique is usually done in a specialist clinic. Okay, and what is the management of hypertrophic and keloid scar? Number one is silicone gel. Okay, treatment with silicone gel can be used in patients of any age and above 2 to 3 years old. And moreover, the silicone gel is very safe, very practical, and easy to use. Another one is pressure dressing, intravaginal steroid injection, which is only done in a clinic setting, cryotherapy, laser treatment, surgery, and over-the-counter creams like onion extract cream. Okay, so now let's go to the next topic, which is the cosmeceutical in skincare. So when you talk about cosmeceutical, you are talking about a cosmetic product with some active ingredients. So I will be talking about some of the most common and famous ingredient in your cosmetic product. Okay, so the first one is glycolic acid. So you can easily see this in your skincare. Glycolic acid is a colorless, odorless, and it is a type of alpha hydroxy acid, which is derived from sugarcane. Okay, the concentration that you usually see in skincare is 10% or less. Glycolic acid has an anti-inflammatory properties. It can reduce inflammation, and also it has an antioxidant effects. So it is very suitable to be used by the acne combination skin or acne prone skin. Another one is salicylic acid. Okay, salicylic acid is a lipid soluble agent in contrast with AHA, which is alpha hydroxy acid, which we discussed just now, which is the glycolic acid. The concentration that you will see in your skincare is 10% or less. It works well with the skin lipids and sebaceous gland, and it has the property to reduce the blackhead and whitehead, and also reduce the sebum on the skin. Okay, now we're talking about another acid, which is lactic acid. Lactic acid is derived from sour milk and tomato juice, and it is also a form of AHA acid, and it is very suitable for sensitive and dry skin. I like to apply this to my patients that have sensitive skin, and it helps them with their acne as well as their sensitive skin, because it hydrates the skin also. So the concentration that you have in your skincare should be less than 10%. Okay, so in this diagram, just showing you, this is how the skin cycle is. But we want to talk about the vitamins that helps the skin, which is also seen in your skincare product, which is the retinols. Okay, retinols is derived from vitamin A. It is an antioxidant, and it helps to stimulate the skin cycle changes and skin cycle. It promotes the collagen production. It helps in pigmentation, photoaging, and also acne and oily skin. In skincare, it comes in low strength and in many forms. And when you are using the retinol, your skin will undergo a certain phase and certain changes in within few months. What I call it as retinization. This is when the part that your skin get adapt to the ingredient, the retinol. Okay, so when you see here in this diagram, the skin layers change from the new skin to the dead skin here. So the dead skin is of no use to us, and this is what retinol do. It actually speed up the process so that there'll be new skin development each time, and there'll be removal of the dead skin each time. Next one is the next one is the vitamin C. Okay, vitamin C, everyone loves vitamin C. It is a very powerful antioxidant. It helps in collagen productions. It also prevents photo damage from the UV light, which can cause premature aging of the skin. It blocks pigmentation, and it helps in skin repair, healing, and improve the barrier function. It is prepared in many forms in your skincare, from the most potent to the most stable form. Next is vitamin B, so which is the niacinamide. It is also called as nicotinamide, and it helps to speed up the new skin cycle, and it blocks pigmentation, and it also has an anti-inflammatory effect and able to reduce redness to a certain extent, and it improves the skin barrier and also moisture the skin and prevent water loss. So whenever that the patients do aesthetic treatments or facials, it is best to also use vitamin D serum. Okay, next one is the pigment lightening agent, which derived from natural extract. There are many, but the one that I would like to discuss with you is two, which is the arbutin. So arbutin is basically a natural hydroquinone extracted from the bearberry and also mulberry. Okay, as you know, hydroquinone is the gold standard in treatment of pigmentation. So basically, arbutin is the natural form of it, and it helps to block the pigment. It also helps with uneven skin tone and pigment lesion like melasma, freckles, sun damage. Mostly can be seen in brightening range in cosmetic products. Another one is resveratrol. So resveratrol is an antioxidant found in grapes and peanuts. It has an anti-inflammatory and also it can block pigmentation. And it also gives a protective effects against ultraviolet rays and also skin malignancy. Okay. So here, just to show to you how melanin is produced in the skin. Okay, there is so many process and so many pathway. So if you see in every steps of the pathway, there is all these cosmetic ingredient that tries to stop the formation of the pigmentations. Okay. And lastly is the hyaluronic acid. Hyaluronic acid is a naturally occurring sugar that is present in the human body. It is found in the skin and its main function is to hydrate the skin by retaining the water to keep tissue well lubricated and moist. So it has an anti-aging properties, anti-wrinkle, anti-inflammatory, collagen induction, and space filling in the case of filler. And it promotes supple, healthy skin and relieve joint pains and also help in healing process. So this is all from me today. So I hope that if you have acne, you have a bit more understanding on your condition and how acne develop and what is the step to be taken in getting a better skin. Thank you so much.
Thank you, Dr. Diana. Thanks for the friends that actually still with us. Currently, we are open the sessions for question and answer. You may drop your questions in the comment box and we'll get Dr. Diana to answer you on the spot. Okay, so now let's start with our own Q&A session first. So Doctor, just want to talk about diet. So will eating chocolate or oily foods can cause oily skin and acne? Is it true?
Yeah, okay, all right. So as I mentioned just now, if you are taking high sugary food, yes, chocolate can be one of the reason why your acne getting worse or why you get acne inflammation, but no for oily food because there is also a study done and confirming that you can't have acne inflammations when you take oily food.
Okay. So how about okay, like just now Dr. talked acne vulgaris. Is it a transitory disease for adolescents? Because we commonly see teenagers actually get a lot of acne issue. So,
okay, it is I wouldn't say that it is a what you call transitory disease, right? Because yes, this is the commonest in young adults, but you can also get it in older patients.
Okay.
Yeah.
So how is this acne can be improved rapidly if they go for treatment? Since for adolescents, mainly is also due to the hormone changes, is it?
Right. Yes. Okay. Okay. Your question is whether it can be improved
Rapidly
okay.
to treatment.
Rapidly. Okay. It's a process because when you have acne, it takes a few days, months to weeks for it to develop, right? So it is also a process when we want to treat it. Probably by few weeks, months And also sometimes it can reoccur back due to all these risk factors like we may discuss just now. Yeah. So it's a process. Yeah.
Okay. Okay. All right. So, okay, there's a question from live that if someone with very oily face and
Mm-hmm.
serious atrophic scar over the face, which
Mm-hmm.
treatment could be advised? Which treatment could be advised to improve the face condition?
Or if having a trophic scar as well
And
as
oily,
the oily.
oily.
Okay.
Yeah.
Um, I would still start with skincare first to treat the oily skin. Okay, as well as for maintenance. And I would say laser therapy would be one options. Uh, Also to certain extent, chemical peels can also help with not so serious trophic scar. And there is also a treatment called skin needling, which is another option for patients who are not really keen with laser treatment.
Okay, so doctor talk about treatments, how these three things work actually to solve the scar problem.
Oh, okay. So when we talk about laser treatment actually involve heat, right? And then
Mm.
the other one is skin needling. It involves creating a small puncture or opening or creating injury to the skin. So both um, both are different techniques, but same concept. We want to induce injury, okay, in a control setting, in the clinic setting, because we want to stimulate healing process. Because when you have healing process, you will have all these steps that I mentioned just now. Inflammation, tissue formations, and collagen productions. So when you have collagen production and also new set of skin tissue formation, this will actually reduce the appearance of your scar.
Okay, okay.
Mm-hmm.
Okay, there's also a question. If I take supplements such as vitamin C, can it help to reduce my acne scar?
Okay, if you take vitamin C, I help to reduce your
Acne scar.
acne scar, right?
Yeah.
Okay. Acne, okay, vitamin C. If you ingest it orally, certain extent, it can induce collagen production, right? So indirectly, yes, it can improve. But there are also studies done. There's a very weak link between vitamin C and also the vitamin C and how it helps with acne scar. But in my personal opinion, vitamin C induce collagen production, and yes, it helps with your acne scar.
Okay. But it will take a longer time, right?
Of course. Yeah, but that's why you say that is for maintenance, right? So like I said just now, you need an induction treatment and you also need an maintenance treatment. You cannot do just one. Mm.
Oh, okay. The
Mm.
same girls actually asking. So
Mm-hmm.
how about take collagen and vitamin C together?
Collagen, eh?
And
Okay.
vitamin C together.
Collagen and vitamin C together. Okay, I agree with vitamin C. It does help. It helps with your skin. It helps with your immunity. It helps with a lot of other things as well. You take it orally, it's good for your immune system and also your systemic and also for the whole skin. If you take serum on the face, it's also good. But collagen, I'm not too sure, but I think because you can only produce collagen by taking more vitamin C. But if you are taking collagen from external, I'm not too sure whether it really helps.
Okay.
Mm-hmm. Mm-hmm.
So it will stimulate own body
So
collagen will be
yes, so if you
better for
want,
this.
so if you want to induce the collagen production in your body, you take vitamin C.
All right. Okay. Okay. Then also, there's also myth saying that sunlight is actually often perceived as a natural cure for acne. Is it true?
Ah, sunlight is a
Vitamin D.
natural. Okay, okay. Vitamin D, correct. Okay. The ultraviolet rays that is good for us is before 10 o'clock. When it is 10 o'clock, 4 o'clock, if you expose yourself to sunlight, it's it will be very bad for the skin. So I would say that it's actually more harmful than you helping your um, skin and improve your acne. Yeah,
Mm-mm.
yeah.
Good. Okay. And then trend now is everyone actually, because just now Dr. talked about cosmeceutical skincare
Uh-huh.
product. So
Uh-huh. Yes, yes.
everyone now, the trend is that they all look for all natural skincare product.
Mm-hmm, mm-hmm.
So
Correct,
will
correct.
all
True.
these natural skincare products still able to solve the dermatologic problem? Or
Okay.
it's just meant
So
for maintenance only?
Okay. So like I always advise my patients yeah, not every natural skincare product is suitable for them. Okay. The one that I really have skin concern should actually focus on ingredient that have benefits for their skin concerns. So this all natural is probably yes, if you want to say for maintenance, it's good, but not when you are on treatment.
Okay. Okay,
Mhm.
understand.
And
Okay, there's a,
yeah, correct.
yeah.
Mm-hmm.
And what else, doctor? Yeah, sorry.
No, 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 no.
Okay,
That's all.
okay. Okay, there's another question now. Is it
Uh-huh.
okay to use silicone?
Mm-hmm.
You use silicone or any other type of face brush to wash my face every day?
Silicone, you mean
Or
silicone brush, is it?
face brush, silicone face brush.
Silicone face brush. Okay, okay. Um, I would think that it will be a little bit harsh to the skin. I would always advise my patient to just use their hands. It's more soft and it's more. It's just enough to use the skin. The hands.
Okay.
Mm-hmm.
So your advice is just purely use the hand will do.
Correct. Yeah.
Okay,
Simple. Simple. Yeah. Hand.
I think there's a time. Maybe doctor have some words to our audience before we end the section. Any
Uh,
advice?
Oh, any advice? Okay. My advice, since my topic today is about acne inflammation, so when you have acne inflammation, you don't wait until it get worse, then to get to seek for treatment, because when the time when you have inflammation is the right time to seek for treatment. When if it gets worse, then you might have the risk of scarring, and at that time it will be a lot difficult to treat the acne. And also, when you are on treatment, it's always best um, to
Follow.
yeah, yeah, follow all the steps in whether you are in induction phase or in maintenance, and just always also communicate with the clinic of anything that you have any questions and what. Okay, the clinic will always help to uh, solve your questions. Yeah.
All right.
Mm-hmm.
Thanks again to Dr. Diana for tonight taking the time to actually do the sharing for us. So
Thank
you
you,
guys, if
Shereen.
any any further question, you may actually can see how to contact Dr. Diana in our
Mm,
post. Okay.
yeah,
For friends and students, please do share around today's live so that more people can benefit from it
yeah,
and stay away from acne skin issue. So we live in a happy life. Okay,
yes.
before I end,
Uh-huh.
next Wednesday we will have a talk by a gynecologist to Dr. Sharifah to talk about heavy menstruations after 40s, the cause and treatment. For more information, you may check out our announcement post. Okay, the right clinic, the right doctor, the right care, the right information, the right knowledge, no panic, stay at home, mask on, Good night, Dr. Diana, and good night
All right.
to
Good night.
everyone. Bye.
Bye bye.